As a healthcare professional, you will be responsible for the care of several patients simultaneously. But you can't be at the hospital at all times. Whether you are going home from your shift or starting a new rotation, you will need to provide patient handoff each time. Handoff can also be referred to as handover or sign out. Unfortunately, patient handoff is prone to miscommunication. In fact, communication errors during handoff leads to about 80% of serious medical errors. So it is very important that you perform handoff in a very structured and systematic way. You will probably encounter different systems for handoff, but one mnemonic I find useful provides a framework for handoff. It is called the 5S. So the 5S's are: first is severity, then story, then steps, then about the situation, and finally the receiving person should say it back again. The first part of the 5S handoff is to describe the severity of your patient's condition. This helps grab your colleague's attention as you describe the patient's illness. One simple way of doing this is to categorize your patient using one of the following words, such as whether it is stable, unstable, tenuous. So based on this, you can categorize your patient. The second part of the 5S handoff is the story of the patient. You want to succinctly communicate the patient's identifying information, reason for admission, and current events or treatment plan. Your patient's story should include three main parts. They are summary statement, hospital course, and assessment and plan. If you include all three in your report, you will inherently include all pertinent information. In summary statement, you include patient's demographics, temporal pattern of illness, and clinical syndrome. The next S in the 5S handoff is steps. This is the point in the process where you review the to-do tasks for your colleague. You want to include very clear, specific elements of the to-do list. Your colleague may not have the same in-depth knowledge as you do of the patient, so you should provide context and clear instructions. Core elements of your plan for next steps must take into consideration the following: timeline, responsibility, and course of action. For timeline, include how often or by what time you would like a task to be completed. Establish responsibility by clearly designating who is assigned this task and develop a course of action plan for some of the most likely results. In summary, the elements of a good next steps list include a timeline, who is responsible, and a course of action with specific guidance. The next S in the 5S handoff stands for situation. This is meant to provide anticipatory guidance in case things go wrong. You want to provide a clear framework for problem solving the most likely issues to arise while you are away. This is critical for patient safety. In the situation, you need to think about what might go wrong, what specific steps need to take place if an issue occurs, and what additional resources are needed, and what is the chain of command. You want to provide details based on your colleague's level of experience and familiarity with the patient. The last but not the least S in the 5S patient's handoff is say it back. The value of say it back is not just to have the receiver report what they understand about the patient handoff, but it's also an opportunity for them to ask clarifying questions. It is important to note that say it back is not a complete repeat of what was said already. It might vary depending on the stability or complexity of the patients. For a stable patient who the receiver knows well, for example for consecutive night shifts, This may be very brief. A simple statement that the receiver affirms the handoff might suffice. To summarize the 5S again, first S is severity, second S is story, third S is for steps, and fourth S is for situation, and finally the receiver has to say it back again and ask clarifying questions. Thank you very much for tuning in. Thank you.